This video will provide step-by-step instructions on how to use your VersaPump mechanical infuser and is intended for educational purposes only. For more information, please consult your healthcare professional. Prior to getting out supplies or medication, you will want to wash your hands thoroughly for at least 20 seconds using soap and water. If no soap and water is available, use an alcohol-based hand sanitizer before handling any supplies. Wear gloves if you've been instructed to do so. You will want to disinfect your work surface prior to laying down any supplies or medications. You will now want to place all supplies onto your prep mat or clean work surface. If using a pre-filled syringe, you will skip this next step. For drugs supplied in vials, transfer indicated fluid from the vials to the syringe according to the product labeling or as instructed by your healthcare professional. You will not want to draw fluid into the syringe until it is time for use. Please read and follow all instructions for the indicated fluid and components prior to use. Prior to administration, verify you are using the correct VersaRate flow rate controller, OptiFlow needle set, and syringe prescribed by your healthcare professional. Begin the infusion setup by connecting the rod to the syringe plunger. Verify the expiration date and ensure the sterile packaging is not damaged. Remove all supplies including the infuset or flow controller, OptiFlow needle set, and syringe from the sterile packaging using a septic technique. Do not remove any caps from the supplies at this time. You will now remove the sterile lure lock caps from the infuset or VersaRate flow rate controller. Connect the syringe male lure lock to the infuset or VersaRate female lure lock using a twisting motion while making sure not to over-tighten. Next, remove the lure lock cap from your needle set and the other end of your infuset or VersaRate flow controller using a septic technique and connect to the OptiFlow needle set using a twisting motion while making sure not to over-tighten. Ensure the flow rate controller is set to the off position to prevent an early start to your infusion. If using infuset, we recommend manually priming the tubing by gently pushing on the syringe plunger to fill the tubing and needle sets with fluid as directed by your healthcare professional. Prime until you see the fluid within 1 or 2 inches before it reaches the needle for a dry prime. Try to avoid fluid coming out of the needle. Now it is time to load your syringe into the VersaPump. Place the pump on your clean, stable work surface. With one hand, hold the lower portion of the pump near the latches and push both round buttons to release the top cover. Using your other hand, grasp the top cover near the latches and pull firmly until the top cover is fully open. You will now load the syringe into the pump with the graduated numbers facing you. Ensure the syringe flanges are securely fastened in their designated slots. Close the top cover until you hear an audible click as the cover engages with the latches. It is now time to prime the tubing. Slowly open the VersaRate flow rate controller until you see the fluid within 1 or 2 inches before it reaches the needle for a dry prime. Try to avoid fluid coming out of the needle. After priming, you will need to close the flow controller. For the infuset, slide the clamp closed. For the VersaRate flow controller, turn the dial to the off position. You will want to ensure that they are clamped or off prior to placing your syringe in the infusion pump to ensure that you don't have an unintended start to your infusion. Next, remove the wing guard and place it into the AccuCert needle inserter. Draw back the inserter until you hear a clicking sound indicating the needle is locked in place. Remove the needle guard and set aside to prepare the injection site. Do this by cleaning each site with an alcohol prep pad. Place the AccuCert over the injection site while pinching your subcutaneous tissue and press the button to release the needle. Alternatively, you can remove the wing and needle guards and insert each needle manually. Place the soft site dressing over the needle set. Note the window does not contain adhesive for easy application and removal following infusion completion. If instructed by your healthcare professional before starting the infusion, but after the needles are inserted, gently pull back on the plunger to ensure no blood is flowing back into the tubing. If blood is present, remove and discard the needle set. We can now start the infusion. Your pharmacist or infusion nurse will provide calculator flow rate instructions. If you use an infuset, open the slide clamp which will allow the fluid to flow. If using a VersaRate controller, simply turn the dial to the appropriate number as advised by your healthcare professional to start the infusion. You can monitor the infusion by viewing the syringe volume. After the infusion is complete, or if you need to stop the infusion for any reason, turn the dial to the off position or close the clamp. Once your infusion is complete, you may open the top cover of the VersaPump and remove the syringe. If the infusion protocol requires more than one syringe, disconnect the empty syringe. Using a septic technique, you will need to attach the next full syringe to your infuset or VersaRate flow controller. Place a new syringe in the VersaPump using the same process as before. Once the knob is closed, you may open the slide clamp on the infuset or turn the dial on the VersaRate to the appropriate number as directed by your healthcare professional and infusion calculator. Remove the soft site dressing and needle sets at a 90-degree angle or as directed by your healthcare professional, making sure to use the safety mechanism by pinching the wings shut. Dispose of all supplies, syringe, and needle sets in an appropriate biohazard or sharps waste container according to your local regulations. Clean and store your pump in a safe, dry place or in its carrying case for next use. To clean your pump, you may use 70% isopropyl alcohol wipes or a soft cloth dampened with a weak solution of mild detergent in warm water, approximately 1 part detergent to 50 parts water. Do not at any time attempt to disassemble or clean any part of the pump that is not easily accessible. Tips: Infusion with the VersaPump system is safe and simple. Thousands of patients have successfully mastered subcutaneous self-administration. No two patients are alike, so work with your care team to personalize your therapy for you. Some site irritation is normal and it should diminish with time. Longer needles usually don't feel any different from short needles, and in many cases they work better and irritate less. With time, you'll discover which sites work best for you. The eMed team is here to support you and your infusion success.